fire. Markets are up at off the day's highest point. Pfizer had signed up a deal with Biocon to sell Biocon's insulin drug. That deal is off now. I've got Kiran Mazumdar-Shaw, CMD at Biocon, joining us on the phone line to talk about why this has happened and what are the implications. Ma'am, thanks very much. Good morning. Prashant here. Could you talk about what happened?
Well, basically there was a change of business priorities at Pfizer, and they felt that they would like to focus on other biosimilar programs, largely monoclonal antibodies and recombinant proteins. And, you know, the two companies felt that it was in their best interest for Biocon to really pursue the insulin, biosimilar insulin business on its independently. And, you know, we had a very amicable parting of ways as a result of this change of business priorities at Pfizer's end.
Ma'am, something would have changed, right? Because towards, you know, late January, I think it had been stated that both parties are actually aggressively pushing forward on this deal. I mean, so they're selling more, you're supplying the drug. I mean, so it was going well, right? As late as late January.
I think what you're referring to is really the market in India, because the only market that Pfizer had launched in was India. India is a very small market, Pfizer, and in the context of the entire deal, it is fairly insignificant.
No, I get that, but I'm just referring to that as a sign of, I mean, things going well as late as late January.
I think you must understand this in the context. India is a you know, one small market for Pfizer. This was a corporate decision. This is a decision where business priorities at the corporate end basically changed in the biosimilars strategy.
So what does this mean? There is some speculation that, I mean, this would, is it a clean break-off, or, you know, some monies will have to be returned and that kind of stuff?
No, it's a very, very amicable separation. Biocon gets to keep all the monies that Pfizer have paid thus far.
Right.
It will receive a small additional amount at the time of this for this settlement. And really, as far as Biocon is concerned, nothing changes, because Biocon was always responsible for delivering and developing and delivering the products to the market, to Pfizer for marketing. We were also responsible for manufacturing, so nothing changes on that front. Biocon continues to develop these biosimilar insulin programs, and we continue to remain very, very confident that we will make a global play of our biosimilar insulins portfolio.
Ms. Shaw, you know, if I'm not mistaken, there was also the accrual of licensing income to Biocon from Pfizer, which now doesn't take place.
That's not true. We have already received, you know, they paid us an upfront, if you remember, of $100 million. So there was no additional licensing income. There were only regulatory milestones which we would have received over the next 5 years. Most of these regulatory milestones would have come, you know, 3 to 5 years from now. So that's the only thing that will not accrue to us.
Right. From Biocon's standpoint, I mean, since Pfizer was just their marketing alliance right now, are you exploring other avenues to find another marketing alliance right now, or that's going to be taken on board by Biocon itself?
Well, you know, Biocon's strategy will obviously undergo a change, you know, from having just one single global partner like Pfizer. We will now move towards multiple regional partners. That's our plan. We already have several existing regional partners which predates our Pfizer deal. And these are partners with whom we have been able to penetrate several key emerging markets: Brazil, Mexico, other Latin American markets, some Southeast Asian markets, Middle East, North Africa. So, you know, these are very strong partners that we have, and we will continue to leverage these partnerships in the short term, and we will certainly be prudent enough to look at new alliances for other regional markets.
Ms. Shaw, for these particular products, for these particular insulin products which Pfizer has been marketing, I'm talking about those, are you going to have a replacement as a marketing alliance for these?
No, but that's what I said. I'm referring to that. Exactly that I'm referring to. I'm talking about the fact that we actually had existing regional partners in many markets with whom Pfizer had agreed to do co-marketing. Okay? And there was also other, now going forward, we will look at new alliances.
Ma'am, does this raise questions on the insulin program at Biocon itself? I understand late-stage clinical trials were going on for some of these products.
Exactly. So we are in very late stage of phase 3 trials for European registration, which are almost nearing completion.
No, so this will
we
raise
are
the question.
also in global phase 1 trials for insulin glargine, and we have an active US IND in place.
Right.
So we are on track. Everything is going as per plan.
Okay. So that's what I want, because obviously some people will ask whether Pfizer saw something that they didn't like with the late stage trials for some of these products. So you're saying nothing of that sort. It's all on track.
It's all on track. You know. So I believe that we are still in place to pursue our commercialization strategy in global markets.
All right, ma'am. Thanks very much for your time. Great to have you with us here on the show. Good luck with that insulin product. So, the strategy remains on a track as of now. Divina.
Another focus would be, we've been talking a lot about the credibility